Okay, yes. Speak a little bit more about where you see this going, this the heated yoga research.
So what I would love to do is really a dismantling study where you're, and this was Maurizio's idea. It's a 4 square. So it's like heat, no heat, yoga, no yoga. And you have 4 groups. The problem is powering that study is very difficult. So then I'm thinking, okay, if you just pick 3 of the squares, which 3 would you pick? Because if you just go into NIH and you're saying, I'm going to run this big trial, I think it's hard to power those 4 groups to find statistical significance. So okay, so let's pick 3 groups, keep it simple. Then the question that I think is clinically relevant is if you have a patient in front of you and they're depressed and you could tell them to go to yoga, it's sort of like, are there certain people for whom heated yoga is important? Are there certain people for whom it's contraindicated? You know, they're gonna have a bad experience. Because I don't think it's for everybody. Like, I think it's pretty rigorous, right? So if you have like a heart condition or you're on certain medications that are dehydrating, things like that, and we wrote 2 case studies on women in their 30s who were athletic, who had very treatment resistant depression in the study, the randomized control trial. We added Bikram yoga to their treatment regimen, and both of them, their depression went away, like almost down to nothing. And these were people who had tried everything. One of them was getting ECT, and still like, pretty severe depression. So we published those 2 case reports just because we were sort of astounded that, like, wow, like if you add this to already existing treatment regimens, people may just get better. Like, this is pretty wild. But I guess both of those women were 30, they were athletic, so like, could you take like an 80-year-old and put them in Bikram yoga with a heart condition? Probably not. That would probably be bad. So I don't know. And part of the reason that whole body hyperthermia is compelling is you could take somebody that doesn't have to do the athletic component of it, right? So you could take someone who's maybe a little older, who's more out of shape, who there's like a bigger hurdle to getting into that room and asking them to contort their body in all these ways. So
that makes it potentially more accessible to more population,
I
more
think
members
so.
of the population. Yeah. Okay, that's great.